Welcome to the Positive Gene Podcast. My name is Sara Kavanaugh. This is a podcast empowering cancer previvors and survivors over our hereditary cancer risk. I started this podcast because I had so many questions after receiving my genetic testing results and not only wanted, but needed to truly understand what it meant to have an inherited cancer mutation. We will discuss important topics from a patient perspective, like finding credible online resources, opportunities connecting with others for support, and building your medical team, and so much more. We're all in this together, and I'm so thankful for your support. Let's dive in. All right, friends, welcome to another episode of the Positive Gene Podcast. This is Sara Kavanaugh, and today we have a very special guest, Natalie Samson. Natalie is a board-certified genetic counselor and the founder of Golden Genetics. She is dedicated to transforming healthcare through personalized, integrative, and preventative approaches. Natalie holds certifications in integrative health coaching and is completing her certification in integrative and functional nutrition. Her practice uniquely combines traditional genetic testing with cutting-edge nutritional science, focusing on cancer, neurology, nutrigenomics. Natalie and I connected over social media and our shared goal of empowering people with the knowledge they need to manage their health proactively, and specifically in the space of hereditary cancer risk. So today, she is here to discuss how integrative genetic counseling can play a crucial role in managing health risks. And we're going to have a special focus on pancreatic cancer because at the time of recording this and launching the episode, it will be Pancreatic Cancer Awareness Month. So let's get started. All right. Welcome, Natalie.
Oh, thank you so much for having me. So excited to be here and just love this podcast. So thank you.
Yeah, thank you. Alrighty, well, let's start with sharing your journey into genetic counseling, and then what led you to integrate the alternative practices, I guess you could call that, or integrative practices like nutrigenomics into your approach at Golden Genetics.
Yeah, definitely. Okay, so I went into genetic counseling originally because I always was so fascinated with how the body worked from a really micro level. And so genetics, what I loved studying genetics because that is, in essence, I think, the root of a lot of conditions or diseases or how we respond to the environment and our health. And so I thought it was fascinating, but I also really wanted to work with people one-on-one, and I really liked the counseling component of it. So genetic counseling was kind of a perfect blend of those two passions. But when I went into genetic counseling school, so through my journey, I ended up choosing to specialize in cancer. And the reason was because I really liked how there was an opportunity to be proactive and preventative after understanding your genetics and your potential hereditary risk. And so I really love that aspect of it. So I was working as a cancer genetic counselor in a hospital system, and while I was there, I always also really appreciated holistic healthcare, and I myself was working with a nutritionist and a naturopath. And so when I was in oncology and talking to patients about hereditary risk, I really, thought, we as genetic counselors have such an amazing opportunity to guide patients in this preventative proactive realm. And we know so much about screenings and surgeries and how amazing these modalities can be for risk reduction. But, we weren't really necessarily talking about nutrition and lifestyle and environmental exposures and how these things can also play a huge role in cancer risk. And so, with that, I kind of thought, wow, as genetic counselors who have this time with patients, can we go deeper with helping patients and guiding them with that risk reduction? I also, had family history of cancer and kind of saw firsthand how important this conversation could be. And I think as genetic counselors, we have just such an amazing opportunity here because we have the ability to speak with patients for longer periods of time. Oftentimes oncologists are, they have less time with patients, and, a lot of practitioners kind of have less time. And so I was, thinking, can we at least play a role in guiding patients to referrals and, specialists in this area, or ourselves also be able to help patients a little bit more in these aspects? So, long story short, that is why I started my practice, to try to bring an integrative perspective to cancer genetics. And then also it kind of expanded from there to incorporate also other diseases like Alzheimer's and, heart disease, and then nutrigenomics as well, which, we can get into more. So, but that is really how I became passionate about starting Golden Genetics, to bring that approach.
That's great. I think it makes perfect sense integrating those two worlds together. You're right. You get to have that conversation, as somebody who's been on the receiving end of working with a genetic counselor. They can talk about best practices and lifestyle changes and that sort of thing, but not in a practical sense, right? And I think what I love about what you bring to the table with incorporating integrative medicine and holistic approaches is really looking at the whole person through this journey. All right. Thinking through the patients that you're working with, all walks of life, all ages, and all phases. Um, One area, though, that we are seeing more recently is the rising cancer rates in younger populations. So maybe you can talk us through that kind of I don't want to say that it's a recent discovery per se. I think it's a trend that has been seen. Most notably, I've read more so like in the colorectal cancer space, seeing people under 50. We've seen this, more recently, was it James Verbeek shared that he'd been going through colon cancer treatment over the last year. And, he's in his he was mid to late 40s at the time when he has shared this. And what I appreciate about folks like, those that are in the media or in the spotlight in some way sharing their story, that this disease or other types of cancers are rising. We may have a lower incidence, like the bigger picture rates are going down overall, but then some cancers we're finding in folks that are of younger populations that we haven't seen before. But yeah, with cancer increasingly affecting younger populations, what are the key genetic factors that we should be aware of? What are you seeing in your space? And then how can proactive genetic screenings help us?
Yeah, so there's so much here, like you were saying. I think there could be so many reasons, and we're still trying to understand and figure out, why we're seeing younger populations impacted. But I think regardless of, all the reasons, this is where I think genetics is such a powerful tool to help younger people be proactive. And I think a lot of people don't really understand how powerful it can be. I know that people have somewhat of a fear of understanding their cancer risk, which I fully, that is totally valid. And why, as genetic counselors, we are trained in counseling to help you through decision making on if you want to know that risk. But I think a lot of people don't understand that there are a lot of things we can do about it if you're at increased risk. I oftentimes hear people or patients say, I don't think there's anything else I would do about it if I knew. So what's the point? But that is where, a huge aspect of understanding our genetics and the power of it comes in with enhanced surveillance and potentially risk reducing surgeries. So a huge part of cancer is there's such a difference between cancer being caught at an early stage versus late stage. I also think a lot of people don't understand that as well. I'm sure your audience does. But, cancer diagnosed at a later stage, that is where a lot of people may not have treatment options even. And that is where, especially with pancreatic cancer, unfortunately, you do hear people given short amount of times to live beyond that. And when cancer is caught late, there's so much more we can do about it. And so with genetics, if we understand that you are at increased risk, you have the ability to qualify potentially for early screening, and that can save your life. Because if you're able to catch cancer early, most often it can, just be removed with surgery, and sometimes further treatment isn't even necessary. And so with younger populations, I think a lot of people don't know that if you're at increased risk with, genetically, then you can even sometimes start screening as young as, 25 or 30. So depending on the gene mutation. So I think, it's so helpful and especially important now that we're seeing cancer increasing, cancer in younger populations. That's where genetics is even more essential. So if you are at that increased risk, we can catch it early. So I think that's one part. And then also it's so helpful to work with a genetic counselor because that also allows you to stay up to date on new technology and research. So, there are things that are coming out all the time. For instance, a lot of people are starting to hear about a test called Gallery or Grail, which is a blood test that can, does have the potential to detect cancer through a simple blood test rather than going through screenings and surgeries. And so as research like this evolves, we can tell our patients and give our patients this insight so that they are up to date with that research as well. The last thing I'll say on that too is, from an integrative perspective, which is obviously the way that I try to view things in my practice, is we do know that things like there are differences in diets, and there are differences in lifestyle and habits and chronic stress and all of these things that are playing a role in cancer development as well. So, it is something we're starting to wonder, what aspects outside of genetics could be playing a role in why we're seeing younger diagnoses. And so I think, being able to talk about that with patients as well, and having, even younger populations understand the impact of the outside world and also internal world, chronic stress, et cetera, that has on their risk is just so important too. So I think being able to talk through that with people as well will be helpful.
I guess while we're on that topic, what does that process look like when somebody reaches out to you? I imagine much of what you do with your patients is done virtually. Take me through what that process looks like.
So I always meet with the patient initially for, I say pre-test counseling, but just an initial session before we even do testing to see where they're at. Because, I think there's kind of a problem where right now in genetics, it's genetic testing. All these laboratories are so available to people, but oftentimes, unfortunately, I see patients coming in with genetic tests that, aren't the best quality or aren't accurate. So we always see to, where you're at before we order a genetic test. Because also for me, I need to make sure if we are ordering testing, we're ordering the right one. In that appointment, review your personal and family history. And then from my standpoint, I'll also talk about your current lifestyle and habits and diet and how you feel, so assessing your life and yourself from a holistic perspective. But then we'll talk about, if you've already done testing, we can talk about the updates that have happened potentially to your results. So if you've already done testing that again is accurate and we trust that laboratory, etc., technically the genetic tests are one-time tests. So your DNA doesn't change from when you're born. So I think, people ask me that all the time. Technically, if you know that you have a mutation in a certain gene, that's something you were born with and won't change. But our research on that specific change in that gene changes all the time. And so that means that our recommendations that we follow and guidelines that we follow change all the time. So that's why I think, it's helpful to check in if you've already done genetic testing with a genetic counselor to see if there are updates on that and what we know in terms of what risks there are that are associated with that change. And then if we're doing testing for the first time, of course, being able to choose the specific test that aligns with your family history, your personal goals, your family history, and what makes sense for you at this stage. So I think all of those factors. And then, of course, there's nutrigenomics. This field is oftentimes not discussed, when you see a genetic counselor. So I think, I love being able to offer this to patients. I think unfortunately, there is a lot of misinformation in this space, like I was kind of talking about. So I think you have to definitely be careful with ordering this on your own. But nutrigenomics is such a powerful tool, in my opinion, to assess and get deeper and look at different genes. And I love to combine this test, especially with my patients who are at increased risk who have mutations in kind of more, I say, like high risk genes, because this type of testing can help us understand how your body will respond to the world around you. And if we can incorporate things in our diet or lifestyle that can be supportive for other genes that are going on in your body. So, for example, the inflammatory pathway. There are a lot of genes we can actually test for associated with inflammation, and we know inflammation, can play a role in cancer development. So I love to also combine these types of tests. And for inflammation, for instance, if we see that you genetically have an increased risk for chronic inflammation, for instance, can we talk about the anti-inflammatory diet, or again, get this information and then potentially refer you to a nutritionist with this information? So it's just another way to incorporate personalized healthcare too.
That's really interesting and piques my interest to think of something like anti-inflammatory, specifically for people that are at high risk for cancer, right? This is one potentially simple way, in addition to already making some necessary nutrition changes or adapting things in your environment as best that you can, and reducing alcohol and not smoking. I mean, there's a lot of elements, but when you have some data to kind of back it up, it helps you prioritize and really focus on the things that will make the biggest impact quicker, right?
Yeah, I love zooming in on kind of the cellular components of nutrigenomics, which is inflammation, detoxification, oxidative stress, and methylation, which there's a lot with methylation. There's kind of a misinformation going around about methylation right now. But regardless of that, it's so interesting to be able to see where we could potentially support you in those pathways. And like you said, inflammation, detoxification pathways, oxidative stress, for instance, we know those pathways can play a role. That's why oftentimes people recommend antioxidants in the diet to be, preventative against cancer. So I love being able to combine those tests, like you said, and yeah, get even more specific with what you're already doing. I think I find a lot of patients who are trying to be as preventative and proactive as they can if they already know that they have a mutation, in a high risk gene, or I say high risk, but the genes that aren't associated with nutrigenomics, for instance, really like to be able to get specific, because they're like, okay, we're already eating vegetables, we're already doing the things. So I think it's such a amazing tool to be able to get even more microscopic, or again, like on the using our genetics to be able to be more specific with that.
Yeah, that's great. Yeah, thanks for sharing that information. All right, so let's switch gears a little bit and talk about this current month as we're recording this. It is November 2024. We are observing Pancreatic Cancer Awareness Month. So, how do genetics influence or inform maybe our risk of pancreatic cancer? And in the patients that you're working with that do have that risk identified, what are some proactive steps that individuals can take in minimizing or bringing awareness to that risk?
Yeah, so I think when we're thinking about increased risk for pancreatic cancer and how our genetics relate to that, I think a lot of people will think about BRCA1 and 2, also known as the BRCA genes. And, these genes relate to increased risk of breast cancer, ovarian cancer, and pancreatic cancer. And they're well-known genes. I think that also is primarily due to they were some of the first genes we identified associated with increased risk for cancer. But I hear a lot of patients saying, I've already done BRCA testing and I'm negative, so I already know that I'm not at increased risk of pancreatic cancer. So I just want to mention there are so many genes that we've identified now associated with pancreatic cancer. And I just want to nerd out for a little on what these genes do. I know you've had a genetic counselor here, so you may have gone over this, but I think it's really important to understand when we're referring to these genes. So we have certain genes in our bodies that their role is to actually suppress tumor growth. So what that means is their role in our bodies is to stop tumors from growing. We also have other genes that help repair damage in our cells or our DNA. And so what happens when we're referring to mutations in these genes, what we mean is that some people are born with a change, almost like a misspelling in these genes that are supposed to protect us against cancer or stop tumors from growing. And so people who have a change, or also known as, a harmful change or a mutation in these genes, the reason they're at increased risk is because they have less protection against cancer, or they have less of an ability to stop tumors from growing. And so a lot of people think, I have the gene or I don't, but it's actually, do you have a harmful change in those genes? Because we all have those genes. Those genes are actually really beneficial for our bodies and they help us. So if you have a mutation in one copy of one of those genes, that's why we know you could be at increased risk, because you have less protection against cancer. So I like talking about that with patients, because I think a lot of patients are like, I have the gene or I don't, but it's actually, do you have a mutation in this gene or not?
Yeah, you explained that very, very eloquently.
Well, thank you.
Yeah, it is difficult to explain it in easy to understand terms because it's easy to get feeling like it can get really complex. And I know there are some folks like Mark Hicks and folks that are out there creating visuals to help us understand really what does that mutation mean. And Forrest has some great visuals out there as well to help us really put it into layman's terms. We're not scientists, we're not physicians. Put it into terms that make it easy to understand. And I do know that early in my journey in trying to articulate what it meant to have Lynch syndrome and check 2, I probably misspoke, and now I may stumble on it every so often too, just trying to get the terminology right or depending on who I'm talking to. And I think that's a great soundbite of the way you just described this will be a great thing to share with our followers and for people to really mindfully digest what it means to have a mutation in your genes. And be able to really articulate that is something as previvors we do find ourselves having to mention from time to time. So that was great.
Yeah. Oh, good. I'm glad. Yeah, something on that note too that I just want to mention is, because we have two copies of each gene, oftentimes when we're talking about mutations in genes, we usually are seeing that only one copy of the set of genes has a mutation in it. Most often, sometimes there are two copies. But with that being said, because patients have that other copy working, it's just something to note that having a mutation in these genes doesn't mean that you are going to 100% get a diagnosis of cancer. So that's why we always say, increase risk, and, why we want to be proactive as much as we can. But just something that, I wanted to mention, because I think a lot of people think, they're quote doomed if they have this mutation, and that's not necessarily true, so.
Yeah, great point. Okay, this is something I really wanted to loop back on. You mentioned the link to BRCA to pancreatic cancer. So there is an increased risk for pancreatic cancer if you have the BRCA gene mutation. Now, one thing I want to point out that I hear a lot of people make assumptions that women primarily carry the BRCA mutation. And I mean, thanks to Angelina Jolie for bringing us, to the forefront. But we have to remember men can carry the BRCA mutation as well, which also puts them at increased risk for breast cancer and the other cancers associated with BRCA. So can you kind of speak to that little bit of a misnomer I feel like is out there?
Yes, yeah, I hear that all the time, that the BRCA genes only matter for women and that they only relate to breast cancer. So, like you said, both of those are myths. So, the BRCA genes can increase risk of breast cancer. And then, like you mentioned, that also means that that increases risk of male breast cancer. So, men can get breast cancer. Oftentimes, actually, when we see male breast cancer, we do want to make sure we test if there's a genetic component, because male breast cancer is rarer than female breast cancer, which is why, we want to assess if there's a genetic component. But also, like you had mentioned, the mutations in this gene can also increase risk of pancreatic cancer for both males and females. And so that increased risk is present for both, and in the same amount, meaning it's not more pancreatic cancer isn't more common in females with this mutation. We want to look at that for both men and women. And then also, something that I think a lot of people don't know is that the BRCA mutations can also increase risk of prostate cancer for men. So, we want to make sure that we're offering or understanding that risk, so that men can have the opportunity for really an increased screening for prostate cancer as well. So, yeah, I'm glad you pointed that out. I hear that a lot as well. Something I also wanted to mention really quick, in terms of genetics related to pancreatic cancer is we actually know also that chronic pancreatitis can lead to increased risk of pancreatic cancer, or chronic pancreatitis in general can lead to pancreatic cancer. And so something that I think a lot of people don't think about is if you have a family history of pancreatic cancer, sometimes it can actually be making sure or something that I think is important to remember is we want to also check the pancreatitis genes, because if you have family history of pancreatic cancer, it actually may be chronic pancreatitis, and there are genes that actually can increase risk or cause chronic pancreatitis. And so if we're able to test for those genes to make sure that that you aren't at increased risk of chronic pancreatitis that could lead to pancreatic cancer, just something that can be super important as well.
I'm not sure people would always make that connection, right? Pancreatitis you think is just one of those chronic issues that people just manage, but not understanding that you can have that further tested to understand what your increased risk could be for pancreatic cancer. I mean, the upside is if you have pancreatitis, you're being monitored in some capacity, hopefully.
Yeah, I had a patient one time. The reason I brought that up is because I had a patient one time who came in and she had family history of pancreatic cancer, but she didn't know that family members also had chronic pancreatitis. And sometimes pancreatitis can actually be undiagnosed, and sometimes people actually don't have the chronic pain associated with it, so they may have it and not even know. And so I had a patient who had a mutation in a pancreatitis gene and ended up actually being diagnosed with pancreatitis, which I think is was so helpful because the increased risk for pancreatic cancer was coming from a totally different route than the cancer direct genes to pancreatic cancer. So, anyways, that's why I brought that up.
Yeah, for sure. No, I think it resonates, right? When people can hear, real life instances where people have been tested for something that maybe seem fairly benign, but could potentially lead to something, potentially scary. So knowing what those risks are can help you get ahead of the game. And I think with pancreatic cancer, which a lot of people maybe anxious about, because oftentimes you hear stories of people who do find it later because it doesn't present with very obvious symptoms until much later. And maybe you can speak to that a little bit just while we have a bit of time on this particular topic, what things that people would be looking for, if you could share that.
Yeah, totally. Yeah, I think that's such a big point that a lot of people know that pancreatic cancer, or I hear that people say pancreatic cancer is, quote, deadly. But the reason that pancreatic cancer, oftentimes people say that about pancreatic cancer, also ovarian cancer, is that unfortunately, oftentimes those two cancers are caught at a later stage. So, I think that's why it's especially important to assess your genetics for those two cancers. And for pancreatic cancer, there are screenings like endoscopic ultrasounds or MRIs for people, for high risk individuals. But yeah, I think, pancreatic cancer, we're looking for things like, lower back pain is one that I hear from patients that, they're having this chronic lower back pain, which of course, as we get older, that's common, but it's chronic, GI and lower back pain, or also jaundice. So symptoms that, I hear people talk about that then are later diagnosed with pancreatic cancer. But again, we really want to, the earlier the better. Oftentimes, I mean, I say for cancer, genetic testing, the earlier the better for pancreatic cancer, so that before symptoms even come up, we can try to catch it as early as we can if it does come up.
Mm-hmm. And you mentioned a couple of things that are done for surveillance of those with high pancreatic cancer risk, which could be endoscopy, MRI. What are other tools that we have in the medical toolbox to assess that risk for screenings or surveillance?
Yeah. So there are something that I actually recommend for patients to, who are at increased risk of pancreatic cancer or potential, is there are places that specialize in pancreatic cancer screening. So I always recommend patients to look into those places also so that they can be followed to make sure that they're aware of certain or new research that is coming out, like Gallery or Grail. So I think that's an example. Like there are certain things coming out that will be really beneficial for cancers like pancreatic and ovarian cancer, where those are hard to screen for in general. So I think making sure that you're up to date with those new technologies are especially important for patients who are at increased risk of pancreatic or ovarian cancer. And Force, the organization, is such a good organization for patients to stay up to date on what's out there. We as genetic counselors oftentimes look at something called NCCN guidelines, which are very confusing to read if you're a patient. And I think Force does such a good job into turning those into, I say patient friendly language or just readable language in general. But I think, yeah, those two considerations are helpful.
Yes, I 100% agree that those resources, whether it be going to Force for the more digestible, uh, bite-sized, helpful information into, really context that patients can understand. NCCN as well. I've referenced it as a resource multiple times through the podcast, but yes, it can be difficult to distill the information, especially if you don't want to dig so far down into your particular variant within your mutation, because that can get a little bit tricky too. All right, so now let's switch gears again to integrating lifestyle, nutrition, and environmental factors. Let's get into your wheelhouse and really talk about the interaction between those, and then what strategies that you recommend to, really effectively reduce health risks, especially as it relates to cancer.
Totally. Yeah. So I think, something that okay, so there are certain things we know in research that are going to be helpful versus not helpful for cancer risk. So I think this is such important information for those people who, not only everyone, but those, especially when we know genetically they may be at increased risk. So, for example, we know that a diet that is high in processed foods and sugars, added sugars, oftentimes the standard American diet, unfortunately, can contribute to potentially increasing risk of cancer, especially because it can increase inflammation in the body. And then on the reverse end, we know anti-inflammatory foods, antioxidants, phytochemicals, whole real foods can help decrease cancer risk. There's a lot of research on the Mediterranean diet as well, which is full of omega-3s and, again, antioxidants. And then we know lifestyle habits, so things like getting movement in. And one thing I love, a lot of people know this information, but I love to talk to patients about these specific things. Like, okay, we know getting movement in and regular exercise is good for everyone, but what does that look like for you? Can we incorporate a lunchtime walk into your day? What is that actually? What are these habits look like for you? How can we help you cook more at home? Think people are busy. Can we talk about a meal prepping plan? So I think this is, this information, we know a lot of this stuff, but it's also how can we incorporate this actually and make this realistic for for the patient. And because change can be hard, and when we get into habits or we're busy and we're eating fast food and it's hard, we know that we have to change, but it seems overwhelming. Can we work with you and start small and really find out what's realistic for you? Something I talk about too is I think there's kind of like I think there's kind of an essence that that chemicals and toxin exposure is not important, but I feel like personally for me, as I've researched it more, there are things that we can do about it, like switching to clean, personal care products and cleaning products, air and water filtration. These are easy steps. I don't like to overwhelm people, because I know also that I tell my patients we can't live in a bubble. We don't want to suck out joy out of your life. So, talking about easy, simple steps that may make a big difference in terms of what they're exposed to. And then chronic stress, right? So, everyone knows, I think everyone knows by now that chronic stress can really damage our health and especially increase risk of cancer. So, again, we can say that, but can we bring that down to, what's realistic for you and what's going on for you? Because we can say mindfulness and meditation, but is that realistic for you? Can we even start with 5 minutes in the morning of not checking your phone, for instance? Like, what are little habits that work for you? So, those are things that I like to talk about with patients and aspects. And then again, I really like getting specific with nutrigenomics. So, that's where we can really, get down to sulforaphane is, a molecule in broccoli and broccoli sprouts. And we know that that can upregulate and downregulate certain inflammatory genes, et cetera. So, we can get really specific there with nutrigenomics. And then lastly, I always love to refer because, of course, my expertise is really genetics and helping people, but there's obviously a point where I love to refer patients to specialists, to also help them. And so, from the integrative approach, not only are we talking about screenings, but can I refer them to, a nutritionist or a dietitian or someone in the mindfulness space? So, really understanding what they need personally and then going from there.
Yeah. Those are great suggestions. And I love that you are trying to focus on small changes. That comment has resonated because I've had multiple people on the show who have said, "Hey, you can't change this overnight." Right? You know, maybe changing how you shop at the grocery store, right? But it actually is a little bit more challenging, I think, than many realize. Maybe as a single person or maybe as a couple, it's a little bit easier. But when you have kids, it's a little difficult. And I do talk about my kids in terms of like, it's a give and take sometimes, right? And yeah, so I that's one aspect around nutrition. I think stress is I'm glad you mentioned that because it is so critical to our long-term health. And as somebody who I would like to say in the past had dealt with like health anxiety and just anxiety in general, it can be a very difficult mountain to climb. And I think if people are thinking of ways of practicing mindfulness and reducing stress around your previvorship or survivorship or challenges that you have in your health, just know that every day that you do something to help minimize that, in the long run, you will see actually an aggregate of that stress reduction. That's something that since I found out, especially since I found out my diagnosis, interestingly, knowing that I have a health plan, that I have a team, that I have done preventative actions and put steps in place to minimize my risk, that actually has lowered my health anxiety. I think too, putting those practices into place. I'll use a for instance. I have an app called Welltory on my watch that will trigger when I'm having high stress. And what it is using is my heart rate, right? And it can differentiate when I'm increasing my heart rate because I'm exercising or going upstairs, for instance, or if it is actually caused by stress. It also tracks my sleep. And it will tell you if you actually had sleep that helped improve your recovery and or if you did not. And sleep is huge in terms of stress impact to stress. So I don't know if there's any elements you want to add to this, but I think managing your stress and understanding it can take months of one or two simple things that you're doing to reduce your stress. And as you mentioned, turning off our phones, especially right now, really minimizing your scroll time can be really helpful. Or if you are struggling with, say, the outcome of this week's election, which is what's happened in the past few days here, if you are stressed about, something as impactful as that, find your people, find a community, find somebody you can talk to. And sure, that's potentially, hopefully, a short-term stress, right? But there are ways to kind of manage that. And I think finding those small wins might take several months for you to actually feel the physical impact of that stress reduction. So, all that to say, there are small changes that can actually have a larger impact over time. So,
I love that. I love that so much because, like you said, I think a lot of times patients will come and they look when we're talking about what they can do for risk reduction, recurrence, risk reduction, etc. I think people look at the end goal and they're like, oh my God, I'm doing so many bad things. It's so overwhelming to think about all these things. And I think, like you said, one, support system is so underrated. And the mind connection to all of this, is so underrated. Two, I also think if we can take small baby steps and celebrating the wins, even if it's just today I got into nature, whatever that is for you. I think that's so important, like you said, just to it may not feel like a lot, but the more that you do, the more it'll build, like you said. And especially so with stress reduction and then in health as well, if you're trying to cook more, etc. So I always say, instead of focusing on the angle where you want to be, focus on just little things you can do, focus on today. And also, something I love is that neurologically, we know that the more you do something, the easier it is for your brain to do that again. So, just keep going, taking it day by day, and those little things will become easier. And then, yeah, like you said, I think that's why genetic counselors and why I love to see patients and play a role in this journey for them is because we do have the ability and capacity to spend time with patients to really assess and help them through the psychosocial and psychological components of this, and then also be a guide. And so I always say with the way that my practice is set up too is I can see patients for longer than just twice. And so I always say I really, and like you are, it seems like at this place, I always say that I want to leave the patient feeling empowered and not overwhelmed or fearful of their risk. And so, and leave with confidence. And like you said, my experience with patients is they feel actually better when they have a plan. So, I think that's just such a powerful component of
It really is. Thank God for genetic counselors. That's all I have to
it. I'm
say.
like, where's that? No, thank you. So obviously biased,
No,
but
seriously. I mean, yes, we need to keep pushing for more genetic counselors for sure. So, okay, let's tie in then that anxiety or fear. Like you said, you want your patients to leave feeling empowered. And you've used the Titanic analogy in the past about genetic awareness. So, can you discuss how this perspective of the Titanic really empowers rather than instills fear in your patients?
yes. Yes. Okay. So I love using this analogy. So basically, the way that I describe it to patients is that in the Titanic, we obviously all know the story. A lot of people don't know in the story, though, that apparently the captain of the Titanic ship was warned about the iceberg, but didn't listen and didn't listen until it was too late. The reason I like to use this analogy is because if we view the iceberg as cancer, genetics is the ability to see the iceberg before we hit it. And so knowing your genetic predispositions is about empowerment, because if we're able to see the iceberg early, then we can change the course. And we have the time and the ability to not just slam into the iceberg and then be stuck in a situation where with cancer, unfortunately it could be too late. And so I love using this analogy because it allows patients to understand, rather than avoiding knowing the information like the captain did and the warning signs, and rather than just avoiding that knowledge altogether and then potentially running into the iceberg when it is too late, we have the ability to know that information and then feel empowered and avoid that. And so, of course, I do want to validate that, this can be information that can be hard for people. And so that's again why, we will meet with you and first before we do testing to see where you are mentally at and, where you feel that there are benefits and limitations to the testing. But I think that this is such a helpful analogy for people to understand why we can, the power of knowing and how knowledge is power.
Yeah, absolutely. I love that. All right. So, as we wrap up, I would love for you to share where listeners can find more information about you, about Golden Genetics online, how they can maybe reach out to you for personalized genetic counseling or integrative health support.
Yes, I would love to connect. Even if you just have questions for me, you can find me on my Instagram at Golden Genetics Health. And I am the one who responds to direct messages. So you can always direct message me through there. But also, if you want to look into more about my practice and what we offer, you can go to our website at www.goldengeneticshealth.com. So it's Golden Genetics with an S and then health.com. And then we're also, again, active on Instagram and Facebook. So feel free to directly reach out to me on Instagram, or you can also find a contact me page on my website where you can email me directly as well.
Awesome. Thank you. Is there anything else that you would like to add to the conversation today before we close out the podcast?
I'll just add, please don't be fearful or afraid to reach out to me and also others in this space. I think there's so much power in connecting with others, and know that you're, not alone in this journey. So I think obviously, the community Sarah's building and has built is so amazing. And so, reach out to people. I'm here for you. We're all here for you on your journey.
Awesome. Thank you for that. Alrighty, thank you so much, Natalie. Again, folks, if you want to learn more about Natalie's work or seek personalized genetic counseling, you can reach her at Golden Genetics. I will have all of the links in the show notes, and feel free to drop her a note on Instagram or on her website. And remember, if you enjoyed today's episode, please follow us on your favorite podcast platform to make sure you never miss a conversation. If you're interested in speaking opportunities or sponsoring the podcast, please reach out to the podcast or through our social media channels. I thank you all for tuning in, and keep empowering yourselves through knowledge. And until next time, take care and stay positive. Thank you for spending time with me on the Positive Gene podcast. Your support means everything. If you found value in today's episode, I would be so grateful if you could take a moment to rate and review the podcast. It truly makes a difference. For an in-depth look and links to resources discussed today, check out the accompanying blog on my website at sarakavanaugh.com. Until next time, stay empowered, and remember, you are not alone on this journey.